Hello everyone and welcome back. Okay, so now coming towards the next part of drugs that are important for the medicine talks. The most common drugs. We have discussed the 10 drugs. Now we will discuss the left out 12 drugs. This is Drotaverine HCl. Drotaverine HCl. What are its uses? It is used in case of antispasmodic, and it is used for the dose-dependent analgesic effects, and it is used for the dispensation by smooth muscle spasm. Okay, Drotaverine HCl is used for antispasmodics, and it is used for the dysfunction by smooth muscle spasm, and it is dose-dependent analgesic effects, and the side effects are fainting, nausea, vomiting, and dry mouth. What are the side effects of Drotaverine HCl? These are vomiting, fainting, nausea, and dry mouth. Okay, now the next drug is simvastatin, which is hypolipidemic. What is simvastatin? It is hypolipidemic. This is the clue point. You should remember this, that simvastatin is a hypolipidemic. The uses are that it treats hyperlipidemias and it prevents cardiovascular diseases. What are the uses of simvastatin? It treats hyperdyslipidemias and it prevents cardiovascular diseases. The side effects of simvastatins are abdominal pain, diarrhea, and indigestion. What are the side effects? These are abdominal pain, diarrhea, and indigestion. So simvastatin is a hypolipidemic and it is used to treat the hyperdyslipidemias and prevent cardiovascular diseases, and the side effects are abdominal pain, diarrhea, and indigestion. Now the 13th number drug is rosuvastatin. It is used to treat the dyslipidemia, and its uses are same as simvastatin, and the adverse effects are constipation and confusion. Okay, so rosuvastatin and simvastatin, these are the same drugs. It is used to treat the hyperdyslipidemias, as these are hypolipidemics, and these are used to prevent the cardiovascular diseases, and the adverse effects are constipation and confusion. Now the 14th drug is dexamethasone, which is steroid or glucocorticoid, and it is anti-inflammatory drug for autoimmune conditions. It is used for allergic anaphylactic shock. It is used for eye, ear, nose, and drops, and it is used for oncologic uses. The adverse effects are ulcerations, esophagus, stomach, and duodenum, weight gain and Cushing gout, glucose intolerance, osteoporosis, hypertension, fluid, and Na plus retention and edema. Okay, so what are the dexamethasone? So dexamethasone is anti-inflammatory and it is used for autoimmune conditions, and it is used for allergic and anaphylactic shock. Okay, it is a steroid. Dexamethasone is a steroid, so it is used in broad fields. It is used as anti-inflammatory agent. It is used for autoimmune conditions. It is used for allergies or anaphylactic shocks. It is used for eye, ear, nose, and drops, and it is used for oncologic uses. The endocrine uses of dexamethasone are that it is used in glucocorticoid resistance and adrenal insufficiency, and in OBS it used for the maturation of fetus lungs, and off-the-label use it is used in congenital adrenal hyperplasia and enhancing sports performance, and for diagnostic uses dexamethasone suppression test is used. So these are the different uses of dexamethasone. It is used for diagnosis, it is used for treatment options, it is used for the maturation of fetus lungs, it is also used to enhance the sport performance. The adverse effects are ulcerations, esophagus, stomach, and duodenum, and weight gain, and Cushing gout, and glucose intolerance, osteoporosis, hypertension, fluid, and sodium retention edema. The contraindications or the GI problems that are caused by dexamethasone are stomach irritation and vomiting, Cushing gout, irritation at the application site, and acne and hair growth. These are the GI problems: stomach irritation, vomiting, Cushing gout, irritation at the application site, acne, and hair growth. Okay, so dexamethasone is one of the most common drugs. You should remember this. Anti-inflammatory and autoimmune condition, allergic and anaphylactic shock, and in endocrine use for glucocorticoid resistance and adrenal insufficiency. Now obstructive is used for maturation of fetus lungs, and off-the-label uses congenital adrenal hyperplasia and enhancing sports performance. Diagnostic uses are dexamethasone suppression test. The GI problems are stomach irritation and Cushing gout, irritation at application site, acne, and hair growth. Now the next one is salbutamol, which is beta-2 receptor agonist. What is salbutamol? It is beta-2 receptor agonist, and the uses are asthma, COPD, chronic bronchitis, and exercise-induced bronchospasm. These are the uses of the salbutamol. What are these? Asthma, COPD, chronic bronchitis, exercise, and induced bronchospasms. The side effects of salbutamol are headache, fatigue, irritability, lightheadedness, fine tremors, and arrhythmias. Okay. Salbutamol are beta-2 receptor agonists. And these are the uses: asthma, COPD, chronic bronchitis, exercise-induced bronchospasms. And the side effects are headache, fatigue, irritability, lightheadedness, fine tremors, and arrhythmias. Beta-2 receptor agonist. Then we are having ipratropium bromide, which is anticholinergic parasympathetic bronchodilator, and the uses are acute severe asthma and acute severe COPD. The side effects are dry mouth, blurred vision, tachycardia, and headache. What are the side effects? Dry mouth, tachycardia, blurred vision, and headache. Then terbutaline, which is beta-2 adrenergic agonist, and it is a bronchodilator. What is terbutaline? It is a beta-2 adrenergic agonist, and it is a bronchodilator. These are the uses: fast-acting bronchodilator, short-term treatment of asthma, and tocolytics to delay the premature labor. The side effects are tachycardia, nervousness, tremors, headache, hyperglycemia, and hypokalemia. Okay, so terbutaline is a beta-2 adrenergic agonist. Terbutaline beta-2 adrenergic agonist, and it is a bronchodilator. And the uses are fast-acting bronchodilator, short-term treatment of asthma, tocolytics to delay premature labor, and the side effects are tachycardia, nervousness, tremors, headache, hyperglycemia, and hypokalemia. Then we are having omeprazole, which is proton pump inhibitor, and the uses are GERD, gastric and duodenal ulceration, and gastritis. Omeprazole, the uses are GERD, gastritis, gastric and duodenal ulceration, and the side effects are headache, diarrhea, abdominal pain, nausea, and dizziness. Omeprazole is a proton pump inhibitor. These are the uses: GERD, gastric and duodenal ulceration, and gastritis, and the side effects are headache, diarrhea, abdominal pain, nausea, and dizziness. Then the drug is dopamine, which is used for severe hypotension, bradycardia, circulatory shock, and cardiac arrest. And the side effects are renal failure, cardiac arrhythmias. Okay. Next drug is adrenaline, which is known as epinephrine, and the emergency treatment is bronchospasm, open angle glaucoma, anaphylactic shock, cardiac arrest, and local anesthetic to increase the duration of action. The side effects are CNS disturbance, cerebral hemorrhage, arrhythmias, and pulmonary edema. These are the side effects. Okay, so then the next one is dextrose. The uses are low blood sugar, that is hypoglycemia, and insulin shock, and dehydration, that is fluid loss, and nutritional support, and it is used for the preparing injection medications in intravenous bag. Adverse effects are intravenous irritation reaction, hyperglycemia, that is increased thirst, urine, and hunger, low potassium, weakness, and confusion. Then we are having the lactulose, which is synthetic non-digestible sugar, and the uses are constipation, which is chronic, hepatic encephalopathy, and lactulose breath test, which is small intestinal overgrowth. The adverse effects are abdominal cramping, and borborygmus, and glaze, which is flatulence, and nausea or vomiting. Then we are having the metformin, which is oral anti-diabetic, and the uses are type 2 diabetes, PCO syndrome, and pre-diabetes. Adverse effects are lactic acidosis and GI upset, diarrhea, cramps, nausea, vomiting, and increased flatulence. Okay, so these were the most important drugs. Let's revise. Dotraverine HCl. It is antispasmodic, dose-dependent analgesic effect, and for dysfunction of smooth muscle spasms. The adverse effects are fainting, nausea, vomiting, and tremor. Then simvastatin, which is hypolipidemic, and it is used to treat hyperdyslipidemias and prevent cardiovascular diseases. The side effects are abdominal pain, diarrhea, and indigestion. Then we are having rosuvastatin, which treat dyslipidemias, and same as simvastatin. The adverse effects are constipation and confusion. Then we are having dexamethasone, which is steroid or glucocorticoid, and it is used for anti-inflammatory reaction, for autoimmune conditions, for allergic or anaphylactic shock, for eye, ear, nose, and drops, and oncologic uses. The adverse effects are ulceration, that is esophagus and stomach and duodenum, weight gain, Cushing GERD, glucose intolerance, osteoporosis, hypertension. And the endocrine functions are glucocorticoid resistance and adrenal insufficiency, maturation of the fetus lungs, congenital adrenal hyperplasia, enhancing sports performance, and diagnostic uses are dexamethasone suppression test. The GI problems are stomach irritation and vomiting, Cushing GERD, irritation at application site, acne, and hair growth. Then we are having the salbutamol, which is beta-2 receptor agonist. The uses are asthma, COPD, chronic bronchitis, and exercise-induced bronchospasm. And the side effects are headache, fatigue, irritability, lightheadedness, fine tremors, and arrhythmias. Ipratropium bromide, anticholinergic parasympathetic bronchodilator. Uses are acute severe asthma and acute severe COPD. The side effects are dry mouth, blurred vision, tachycardia, and headache. Terbutaline beta-2 adrenergic agonist and bronchodilator. The uses are fast-acting bronchodilators and the short-term treatment of asthma and tocolytics to delay premature labor. The side effects are tachycardia, nervousness, tremors, headache, hyperglycemia, and hypokalemia. Then omeprazole, which is used for GERD, and the side effects are headache, diarrhea, and abdominal pain. Then dopamine, which is used for severe hypotension and bradycardia and circulatory shock, and the side effects are renal failure and cardiac arrhythmias. Then adrenaline, which is used for emergency treatment and upper angle glaucoma and cardiac arrest, and the side effects are CNS disturbance, cerebral hemorrhage, arrhythmias, and pulmonary edema. Then dextrose, which is used for low blood sugar, and the adverse effects are intravenous irritation reactions and hyperglycemia. Lactulose is synthetic non-digestible sugar, and metformin is oral antibiotic. Okay. In the next section, we are going to discuss the important pictures of medicine which are important for the talks. Thanks for watching.